So we'll go to the next one, Dr. Anand Vinekar. He will be telling about calculating compensation in medical legal cases and planning professional indemnity in our practice. Very important thing. So over to you, Dr. Anand.
Thank you, Dr. Mahesh and Dr. Ashok, for this opportunity. It's always such a wonderful learning experience. I think we are all learning in this, and I learned much more than I actually knew just preparing for this talk. So as introduced very nicely by Dr. Ashok, he's told you what the general legal principles are. The next question is, and this we probably need to know, why and how courts are calculating the legal compensation that may be against you, your hospital, or your team. And it's important to know that because, as you'll see in some of the landmark cases, that's how we might be able to defend ourselves better. So this is not a legal advice. As mentioned, I have a postgraduate diploma in medical legal law, but I'm certainly not a practicing lawyer, but I've got a lot of help from my teachers at NLS Bangalore. So I think, before the trial actually happens in the court, a lot of it happens in media, and that's where all of us really get stuck as medical professionals. As you can see, this medical negligence kills 50 lakh Indians every year, and these are real newspaper cuttings coming out of different parts of the country. And as Dr. Ashok mentioned, there is this concept of res ipsa loquitur, where the entire onus of the burden of proof falls on us as doctors, leaving a mop inside, a scissor inside. Of course, probably in ophthalmology, we can't leave such large objects inside, but enucleating the wrong eye, for example, is just one example of res ipsa loquitur. And ophthalmology may be slightly lower down in the number of cases this is about 2 calendar years. This is a summer particle. You can see surgery gynae very high, and this is actually true across the world perhaps. But ophthalmology is there. It's fairly significant, and that's why we need to know. He's already clarified this: negligence, unethical, and misconduct. So we're going to only deal about negligence cases. The other two are actually well established in the National Medical Council Code of Ethics, which is currently under abeyance. Duty, dereliction, damage. As Dr. Ashok mentioned, firstly, you have to have a duty of care. So a patient is yours only when he subjects himself or herself to your care. And that duty starts as soon as you accept the patient. If you're a free hospital, moment the patient walks in and you have sort of even that 10 rupee registration fee, that's your patient. Patient is cured, you transfer, patient dies, hopefully not in case of ophthalmology, that's when it ends. So that's when the duty ends, and this does not apply to emergency cases. Dereliction basically means when something goes wrong. You owed the duty, you did not perform the duty, and as mentioned, you don't have to be the best doctor in your field. You just have to be a reasonably average one, and reasonable average is not something that's defined so much by professional conduct, not if you practice the professional guidelines, but also that you are complying by the legal standards. So you have to be expected to do something, and that acceptance has to be also currently accepted. Now, as the Jacob Matthew case showed, fortunately for us, it's increasingly difficult for a patient to file a criminal case against us, and exceptions will not be discussed in this talk. So mostly we are going to confine ourselves to civil cases or tort cases. And first of all, why do we even need to know how courts calculate the compensation? And that's because, unfortunately, there is no formula. And it falls only on the fact that, yes, there's a lot of arbitrariness that the judges and the law takes. But if you look at literature and if you look at the cases that have come out just in the past 7-8 years, there are two broad principles, although this is not in textbooks, but this is what you can infer from the major judgments. So one is the multiplier method, which basically falls back on the Accident Claim Relief Act, which is basically someone meets with an accident, is either dead or disabled, and how do courts calculate that compensation? And that methodology is used in medical legal negligence. The second one is the just and reasonable principle. And by this we mean, this falls back almost 50 years now, where the Land Reforms Act, when the government of India wanted more socialistic distribution of land, they took from the landlords and they decided to take it off as government land. And then how would you compensate such zamindars? And that was, of course, some of the major constitutional amendments in the first 15 years until Keshavananda Bharati have all been based on that. So knowing the historical perspective is important because this is how the judges would still think. Now, I'm going to use two main cases as learning experiences, and then we can figure out the formula. So, pardon the photograph there. Ashish Chavan versus Indian Air Force. And this is an important case, firstly, because it's the most recent, 2021. And this soldier is now alleging that he became HIV positive because of a infected blood that was given to him. The blood came from the army hospital, was given to him in the Air Force hospital, and both were held liable. So it was basically against the defense forces. So you can imagine a soldier against Government of India's defense forces. So that's why it's so important. So he claimed 95.31 crores, and because it was more than 2 crores, it went to the National Commission, and this is how he justified it. So if you look at this larger numbers, the numbers are not important, but the principles are 1.5 crores for his traveling expense, 50 lakhs for his medicine, 1.53 for the loss of salary, assuming when he would have retired from government service, and finally the medical expenses that he said could have been used if there were some advances in technology. And now this one here, which is human rights violation, mental agony, defamation, these are called non-pecuniary, as that term has been mentioned already. Pecuniary basically means related to money. Non-pecuniary, not related to money. So we have to be aware of both, and this is how courts will look at it. So now what did the court say? In fact, the court actually ended up giving more salary than what he claimed, but reduced in some other headings, and let's look at that. So this is exactly how a math formula works. This is how much he would have earned into this many months, into that many years left for his retirement, and add a little more because increments, appraisals, 1.6, 40%, these are percentages that are being used. The prosecution said, I mean, this is relevant to the case, that ELISA was not done, you did not check whether the blood was not infected, you didn't even take my consent to give me blood, apparently he had macrocytic anemia, long-standing and so on, and that you took so long to even reply to my judgment, and you've not given me the cases, you did not give me the report when I asked for. And remember, from the government side, the additional solicitor general is fighting. So this is a very high-profile case, and he takes the premise that you're not even a consumer. The same thing that was mentioned under the CPA, you don't even come under it because you were given free treatment. You are a soldier, and we gave you free treatment in a government hospital, and that you did not take expert opinion, that you are supposed to claim within 3 years, again mentioned as an exception. You had pre-existing disease, but this is one thing that the defense will always work on, that is novus actus intervenius, which means that the time he got the blood and the time he became HIV positive is almost 7-8 years in between. So we don't know what happened in between. Perhaps you got something else, there was exposure of some other kind. So that is the defense, it was mentioned. But the court, now this is how the court calculated. So all of that will work so much more on the non-pecuniary. But the pecuniary is right out there for all of you to see. The amount of salary, the amount of allowances he already took. He was taking pension, by the way. So they subtracted all of that and they said, okay, minus the pension, minus the personal expenses, minus how much you've already been paid, here's how much is due to you. And including, they added a helper. So they said somebody needs to help you, 12,500 per salary for that, and so on. The mental agony, he also claimed that his wife divorced him because of HIV and therefore put that also. So they added literally 10 lakhs per component. Loss of employment from other recruiters, mental agony for going for different RTIs, divorce, and there was a court of inquiry that the defense took, and he was not even party to that. So 10 lakhs each, 5 points, 50 lakhs. So mental agony, most cases, in other judgments, you'll find it 10 lakhs, but here it was enhanced to 50 lakhs. So this is the non-pecuniary. In addition, they said you have to get free treatment and so on. So just to come back, now this is how the formula is calculated. The next 2 slides are sort of derived from many judgments. So you have pecuniary, which is expenses related to the current treatment that has already happened. And if you jump, number 3 is future medical expenses. Then in between, you have a 2A and a 2B, which is loss of earning during your treatment, the current treatment, and loss of earning that you may have in your future earnings. That is, that you could have earned, but you can't now because of the disability. Number 4, 5, 6 is damage of pain, which is basically mental trauma, loss of amenities, in this case, loss of marriage, divorce, and the fact that you may not live as long enough, in this case, so expectations of life. In our case, a blind child, a blind patient, the inability to enjoy life would come under 0.6. Now, this is the formula that is used. If you have a simple injury or a personal injury, which is not, and we'll define that, the caps are only in 1, 2A, and 4. And just for elaboration, I've relisted them below. And if it's a serious injury, then you also, in addition, have 2B, 3, 5, and 6. So a serious injury is a grievous injury, and we'll define that. And that's when ophthalmologists are concerned. Unfortunately, a lot of it will be grievous injury. And then 1, 2A, 2B, 3, 4, 5, and 6 may be calculated against us. Just and reasonable to say, just and reasonable to say is a little bit of guesswork. It doesn't use the math. These are some defining cases where, but still, one thing that they always calculate is how much salary that you have lost, number one, and what are the medical expenses that you have incurred. Their principle in these just and reasonable cases is that Latin term there, restitutio integrum, which means how much money will it take to get you back to being as good as you were before the damage happened on you. So that's the rough principle that is used. And it should not be that much that he should have won a lottery, but it shouldn't be so little that it is just nominal. So that's the difference between the windfall and a pittance. And it has to be based on the proven income. You cannot say that this child will grow up and he will earn $1 million per year, and so let's compensate him for that. It is the actual amount. And for that, again, this has been mentioned time again. This is an ROP case, Krishna Kumar, where the child was blind for life. So not dead. So when not dead means at the time of the damage, which is blindness, when the child was a few months old, the child did not have an income. So therefore, to use this formula of current income and future income was not possible. And therefore, this is how that was calculated. Expenses already undertaken by the parents, the pain and suffering, especially of the mother as well, that was added. Lost wages of the mother, because she did not work for about that many years taking care of it, and future care, plus inflation. So this is how that 1.38 plus interest was calculated. For 20 years, the treatment, because the case dragged on for that long, hardship to mother, the current age, life expectancy for all these court cases is taken as 70 years. And the monthly expenses, therefore, into 51 years plus inflation. So that's how it became 1.38 plus the interest they had paid, eventually ended up paying 1.8 crores. Does anyone know what the largest compensation in medical legal history is? Well, it's 6.8 crores, and it's a hospital stone throw away from here. Right, it's in Calcutta, but actually the amount finally paid out was 11.3 crores because interest was added from the time of the damage till the time the patient won the case in the Supreme Court. So this has gone to the Supreme Court. So why is it such a large compensation? Because that person who died was a US national. She was an Indian origin. She was doing her graduation there. She was a doctor by profession. She was doing her graduation, and she died because of, let's not get into the details of the case. And this is how the prosecution calculated. They said that this is how much she could have earned. She would have earned $5.1 million, and then they gave some evidence, but the court said no. As a graduate student, she was getting a compensation of $30,000. Let's say she was going to now earn $40,000 from the following year. They added that to 30%, deducted it from the personal expenses, and unfortunately what went against the hospital was the fact that the dollar at that time was 54 rupees. Today, I believe it's 84, so that's already gone up so much more. This is from the judgment itself, what the prosecution claimed and what the defense said, and finally what the court gave. And this is what somebody asked, vicarious liability. So the hospital was charged 5.8 crores out of that, and 10 lakhs from one doctor, 10 lakhs from the other doctor, and 5 lakhs from the third person. So literally the 99, 95, 98% goes from the hospital, and the doctors end up paying a little less. Nevertheless, this is a very, very large claim. So the Supreme Court has actually put down these norms on medical negligence, reasonable level of skill, reasonable level of care, and that, so it's not, often these cases, when they're put against you, as mentioned already, if your defense is good, most of the time you will be fine. And we are probably waiting for this to happen. As mentioned, it is still not taken off. We are still liable under 304A, under the new law, but it's probably reduced to 2 years. So what are the legal principles? The burden of proof in medical legal lies with the respondents, right? So, and not the appellants, which is basically us. And the damages in theory have no limit. So after I've given you these two formulas, if they have a very good lawyer, they can actually claim more, but you know you're restricted by pecuniary and non-pecuniary. And you can only claim for what will eventually result from what you have done. So, eye injury, suddenly now the leg has a problem, or as Dr. Mahesh mentioned, vitiligo because of VKH, that will not be a cause of what your treatment has performed. And finally, you will therefore be, these are the defenses that you will have, that you will be liable only to the extent of your action. Now, I'm also asked to cover medical indemnity. I just have 2 slides on that. As already mentioned, a lot of the schemes cover it. So two things here, two principles. The amount is up to you. Whatever you can afford, the higher you can afford, the better. But there are two principles. If you're working in a group, in a team, in a hospital, where a lot of people report to you, whether it's a patient care attendant or a technician going out in the outreach, doing your work, you must cover for them as well. And if you talk to your insurance provider, with a small increase in premium, you will be able to cover for them as well. And examples are given here. And this is called the error of omission policy, where if there is an omission or an act of commission done by some of your subordinates who are not in the medical profession, they can also be covered under your policy. And the second principle of medical indemnity is, let's say you have a policy of 50 lakhs. We urge you to take more, but 50 lakhs is what this example is. Then divide it into two policies and probably into two of the schemes. So break it up as 20 and 30 lakhs. This is assumed to be a better fiscal way of doing it than taking one. Now, finally, I'm just going to say that our safeguards against medical legal negligence is to follow reasonable care and skill. This basically means for us, follow what is the preferred practice guideline. Keep great records. Keep it at least till the government happens. In cases of ROP that we deal with, you have to keep it for 3 years after the patient turns an adult. So, because that's how long they can file. So, till the age of 21, they can file a case against you. And interpersonal skills, and finally, last point is medical indemnity. Yeah, thank you so much.
Thank you, Dr. Anand. It was a wonderful